Hello, I'm U.S. Senator Mike Enzi. I want to thank Wyoming PBS, the panelists, and those watching for taking part in a much-needed conversation about Medicare and Social Security. I want these safety nets to be available for you and me, and for my kids, and my grandkids. We're not on a path to have that happen. In 1999, President Clinton realized the bleak future for Social Security if no changes were made. We talked about how the program could be saved for everyone over 55. That was 13 years ago, and we're still saying the same, safe for those over 55. Can that still be true? When Social Security began, no one could retire until age 65, and the life expectancy was less than that. In other words, for most people, they'd never see a dime of what they paid in. Now people live longer than the age at which they can retire. We're also welcoming 50 million baby boomers who will be receiving Social Security, which means 50 million people who will no longer be paying in. Did you know that the money from our paychecks that's for Social Security is sent in and then paid out right away to those retired? There used to be more paid in than had to be paid out in a single month. That excess money was accounted for as though it was in a trust, and is accounted as though growing with a minimal interest payment by the rest of government that are using it, leaving bonds in the Social Security drawer. Let's talk for a moment about federal trust funds. I first learned about how the trust funds worked trying to get some of the money out of the Wyoming Abandoned Mine Land Trust Fund. I was told I had to put money in to get money out. What kind of a trust is that? Does that give you confidence in federal trust funds? When politicians can touch them, they are not trust funds. I suggest that we take a look at what the Australians did 20 years ago. They made their old system strictly a safety net. Then they raised the tax by 3% for the employee and 3% for the employer. But the money went into an investment account for the individual. The investing is done just like the federal employee personal investment accounts with professional managers. The money is then off limits to politicians. And if a person dies before collecting any, his or her heirs inherit the balance in their personal account. And now let's talk about Medicare. More is paid out each year for Medicare than is paid in by all those still working and the match from all the employers. No money is being put away for those who are paying in and who someday will turn 65 and be eligible for Medicare. Medicare is an annual liability, not to mention the biggest growing future liability. Already, I run into seniors all the time who want to see a specific doctor, but they're told that doctor is no longer seeing Medicare patients. And the doctors have to do that to be able to make enough money to be able to keep their doors open, because Medicare keeps cutting the amount paid to doctors and other providers. One of the biggest problems we have with fixing Social Security and Medicare is that seniors organizations go after any person or group who offers any solution. Seniors groups need to put forward specific solutions. Another important thing that Washington needs to understand is that there is no single solution for every family or every patient. A one-size-fits-all approach to health care will never work. Unfortunately, when we mandate funds for a specific purpose, like health insurance, many people are confronted with the reality of fewer choices and higher costs. More than 50 million people will soon be covered by Medicare, yet the funding for the program was diverted for new entitlement programs. The current method of paying providers encourages them to see as many patients and prescribe as many treatments as possible. The program does nothing to reward providers who keep patients healthy. Our nation has made great strides in improving the quality of life for all Americans, and every major legislative initiative that has helped transform our country was forged in the spirit of bipartisanship and cooperation. These qualities are essential to the success and longevity of crucial programs such as Medicare and Social Security. To read my full remarks that I prepared for this panel, visit my website at www.enzi.senate.gov or call my office at 202-224-3424. I thank you again for this opportunity to address these issues, and I look forward to hearing the points made by the other panelists.